inspired to write this paper because we've each noticed that with the rapid progress in therapies for conditions such as advanced heart failure, cancer, and end-stage pulmonary disease, it's become even more important to communicate effectively and compassionately. I'm Dr. Rena Oddish. I'm the director of the Pulmonary Hypertension Program and medical director of Care Experience at Henry Ford Health in Detroit. Together with my colleagues, Dr. Jillian Grafton, who is an advanced heart failure cardiologist, and Dr. Len Berry, who is a renowned health services researcher and professor of business, we've written a piece for the journal called Never Words: What Not to Say to Patients with Serious Illness. We have to communicate both what about they can offer and what they can't, while also taking into account the emotional aspects of these discussions, expecting fear, intense emotions, and the sometimes unrealistic hope for a cure. We believe that certain words and phrases should simply not be used during these conversations. Not only do they lack benefit, but they can cause emotional harm and exacerbate power differentials. This is far more than semantics. Reconsidering the way we present information to patients and families has the potential to open dialogue and accelerate the benefits of therapeutic relationships, enabling difficult decisions to be made in a way that is collaborative and based on the patient and family's values. To write this paper, we surveyed clinicians from our professional societies for examples of their personal never words. We also pull from the extant literature, including in the paper an example from Dr. Cruiser, who explained that when a clinician says, for instance, your mother needs to be intubated, or your mother needs a transplant, need is in this case a never word. The reason is it effectively closes off deliberation about patient priorities. Instead, asking permission to consider what's possible can redistribute power in such situations. For example, replacing "she needs a transplant" with "her heart is getting worse. May we talk about what that means and what we can do next?" This signals an openness to shared decision making rather than issuing a unilateral directive. More thoughtful, intentional communication redistributes power back to the patient. In our paper, we present a table of never words and alternatives that we hope others will build upon and utilize as a starting point for discussion. We discuss ways that clinician educators can bring attention to more deliberate communication, conversations that aim to start a dialogue by inviting honest, thoughtful inquiries and responses from patients and families, learning to recognize words and phrases that unintentionally diminish agency, and working to reimagine their own communication so that patients can actively collaborate with their care team and make the best possible treatment decisions. My co-authors and I hope you find it useful, and we look forward to hearing your never words.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic, is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.